The following segment is sponsored by Renown.
Well, having chest pain, that can be pretty scary. The question is, though, when should you call 911? We've got Dr. DrWilson here. He's the manager of Renown's Chest Pain Center to talk about that. Obviously, if you start to feel something, you can get pretty nervous, but the real question is, when should you call? When should you pay attention to what it is that you're feeling?
Yeah, certainly if you have chest pain, chest pressure is often described as not necessarily pain, but what you're looking for is the other symptoms that something's wrong. So if you have pain and pressure that comes on for 5-10 minutes with nausea, or if you're feeling like it's going into the shoulder, the back, the arm, those are kind of more worrisome symptoms. If you're short of breath with this coming on, you want to call an ambulance for help.
And what if someone is experiencing that brief kind of like a little flutter or something that's going strange, but what should they do at that point?
Yeah, so the very brief kind of chest discomfort, fluttering, we see that a lot in our cardiology office, or your primary care office would be able to kind of make an initial assessment there and decide if you need further testing. Okay. So that's not uncommon. A lot of people present with things like this, but it's always better safe than sorry, but a lot of those you can wait to follow up with your primary care or see cardiology as an outpatient.
Tell me about Renown's Chest Pain Center. What does that mean for patients?
So Chest Pain Center, it's part of our Heart Institute. It's not a specific entity, but it's our whole system. We've teamed up with REMSA, with emergency room physicians, with our own physicians in the hospital and in our clinics to readily identify people that might be experiencing a heart attack and get them the most appropriate, quick care, and then a thorough evaluation if their initial assessment is reassuring.
Okay, so a lot of great information. And if you've got questions, you can also always check out bestmedicinenews.org. Thank you so much for being with us.
Pleasure to be here.